Hello, Healing Spot community. Good afternoon. This is Justine, and I am going to be talking today about birth trauma and the birth field. So I'm going to try to keep this in 10 minutes or less. So welcome. Thank you for joining me. And I do have a little cheat sheet because some of this is new information for me in the way that it was presented to me. But I've been working with trauma for many years in the form of people who are coming to me and still do for chronic pain. So I really specialize in helping people release this from the tissues of their body, which can help them bring peace of mind and move on and bring them to present day instead of ruminating on events of the past. So we're going to talk about birth trauma. I'm going to go over some signs of birth trauma, and throughout this week you're going to see me do some posts reiterating this information. Okay, so what is birth trauma? So basically it's any traumatic birth experience where mom feels like she's lost connection in the birth flow in some way. Okay, it's experienced as a sense of loss or a loss of control, or maybe feeling too overwhelmed. So mom may go into different ways of coping with this, which might be fight or flight. It might be the freeze response. Okay, so these are, I'm going to talk about ways that we can help release this from the body. But unaddressed trauma, if so it's not treated, if it's not released, can really interfere with mom's ability to connect and bond with her child. Okay, it also can decrease mom's confidence in her mothering skills. Okay, so if this is really speaking to your heart today, please listen up. So when we talk about clearing birth trauma, this allows moms to bring her awareness to the present day, so you're not just reliving these traumatic events over and over. And you might not, you may be watching this going, well, I haven't had any birth trauma, but let me talk a little bit more about that, because I have had 2 children, and I would have never, had I not known about this and done some work with it and training, I wouldn't have said I had any birth trauma, but in fact I did with my second child, and that's mainly because of some of the disruptions in the birth process and some of the people that were in the room that weren't bringing this positivity, but also right afterwards, because she ended up having to go to the hospital for a week, and that was very stressful time, and so I wouldn't have said that, but luckily I've been able to clear this with some work. So disruptions in the birth flow, what can that happen from? Well, it can happen from cesarean birth. So if you've had a C-section, especially if it wasn't planned, if you were, a lot of moms have like a birth plan that they, we develop them ahead of time because we really want to kind of visualize and imagine what our birth is going to be like and those decisions that we're going to have to make. So a lot of moms will plan that out ahead of time and talk to her provider, talk to her partner, her spouse, whoever's going to be in the room with her. So if your birth ended up in a cesarean section, we would consider that traumatic. Okay, a birth where you were not able to do what you wanted. Okay, so let's say you wanted to be at a certain position and you couldn't. Okay, or whatever, if things just unfolded in a way that you hadn't planned and it felt like it was coming too fast at you, like those decisions, you really didn't have time to be able to go inward and really decide what you wanted. Okay, having an epidural, okay, that can stop or have a disruption in the birth flow. Interventions like Pitocin to speed along contractions, having to have a vacuum or forceps during delivery. Okay, transferring to the hospital. So if you started out and you really wanted to have a home birth, but things took a turn and you had to be transferred to the hospital. Okay, again, a lot of emotions going on with that. Okay, internal checks. So having to, constantly be checked to see where you're at, where you're dilated, all that stuff. Medical issues for baby or mom. I mean, this can be during labor, delivery, but can also be right afterwards. Okay, if mom and baby were separated after birth. So if mom wasn't allowed to bring baby to her chest and allow that flow from womb to baby. Okay, so that can be traumatic. So signs of trauma. So if when I'm talking about trauma and birth trauma, this can be whether you had a baby very recent, so maybe you're newly postpartum, you have a child, a year or less, an infant, this could be years. So even if it's been 50, 60 years, if some of these signs sound like what you've been struggling with for all this time, please listen up, okay? And I want to tell you that there is help available, okay? So having a disconnection from your body or your pelvic space, okay? We call that like a dissociation, where you've kind of dissociated, and that is a way that we cope with overwhelming circumstances. We kind of leave our body or dissociate from it, okay? Having an altered body sensation or pelvic sensation. So either, not being able to feel enough or having a heightened sense of feeling, okay? Not being able or not willing, I don't know how to say that, but not taking care of yourself, okay? Always putting others first and not really taking care of yourself. Avoiding sexual intimacy, okay? This could be a sign that there's been some trauma in the pelvic area. Anxiety attacks, panic attacks, not making eye contact with other people, okay? Because, you maybe have some shame or you have some of this trauma. Not being attentive to baby, okay? Being depressed or having major mood swings, okay? Feeling distracted or spacey, not being able to focus and be present with, the situation around you, okay? Not feeling in the present moment, always thinking about things in the past, okay? Or even worrying about things in the future. Recurrent or obtrusive thoughts, okay? If you have this like reel going in your mind and you're always thinking about the same thing, okay? That could be a sign of trauma, okay? Feeling disconnected from your partner, your spouse, the person that's your baby, helping you with your baby, feeling that disconnect. Having tight pelvic floor muscles, so where you're feeling like, that's kind of the first place that we clench up when we're not feeling safe, okay? When there's been some birth trauma or trauma in general, we tend to tighten up the pelvic floor muscles, okay? Vaginal guarding or absence, really not even being able to feel your private areas. So those are just some signs that you may have experienced some birth trauma, okay, and some disruptions in the birth flow. So the birth field is basically just this energy that's around mom, and it opens up during the birthing process. It opens up to really fill the room. Okay, so we all have this energy field around us, this aura, what have you. I've heard anything from it's 3 to 4 feet off of our body to some people say it's up to 50 feet. So we're beyond just our physical body. We do have this energetic field around us. So this birth field is basically, it opens up even wider than normal. It fills the space, and during that birthing process, mom feels things about 1,000 times more sensitive than she normally would. And this birth field can stay open if there's been a traumatic birth. This can stay open indefinitely, okay? So I want that to sink in, because that's why I'm saying if you've had a baby 50 or 60 years ago or whatever, you may still be trying to just deal with and process the birth trauma. So even little things like having somebody in the room that, isn't bringing this positive energy for you, or holding, this positive space for you, that isn't really letting you feel like what's going on in your body and being able to trust that, that can be, a trauma. But then, add on things like I said, a C-section, scary medical interventions, baby, starts turning for the worse, or you as mom, okay? So just some helpful tips, like I said, this can be treated, okay? So in the birth healing classes that I've taken recently with the Institute of Birth Healing, we have learned about how to balance this birth field and realign it, okay? So I'm not going to go into the specifics of that, but just know that can be done, and you don't have to relive every single moment of it, okay, to do that. Myofascial release, basically we're releasing the connective tissue of the body that stores a lot of information, a lot of memories, emotions, and that can hold you hostage to past events. So it's a very, very gentle technique that I do, where I just place my hands on and I'm listening to the tissues, and I'm helping moms reconnect with what's in there. What does that feel like? And we go into that area and allow it to soften and change and see what it is. It might be grief, it might be sadness, it might be extreme fear. So myofascial release is a very effective treatment option, okay, and I've been doing that for several years. let's see, feeling into the tissues, I already mentioned that, allowing them to be heard and allow them to release. I'm going to talk about some essential oils here in just a little bit that I have found helpful in not only birth trauma, but also helping people with any kind of overwhelming feelings, okay? Working with somebody that has some experience with this, okay? So I've been doing myofascial release for the last 5 years, and really do specialize in it, and it's more than just, you know, like a massage technique. It really is a whole body approach, okay? And I've done a lot of studying on trauma and how to help people, moms and dads, okay? Or even non-moms and just men and women in general, okay? Working with a mental health provider, especially somebody that has experience in trauma care, okay? So there's several providers that I recommend. So if you want a referral, let me know. Using something like EMDR, eye movement desensitization, I think it's response, I don't know what the R is, reprocessing, but that's a really great way to move on past through some trauma, okay? That's provided by a mental health provider. And then bringing breath and awareness to the pelvic floor and working on those specifically for relaxation. So like I said, even some essential oils, I recommend this Feelings Kit. It's a really great kit. It has 6 oils. This is one that comes in the kit. I bought an extra big bottle that I use with patients in my practice as well, just to help them release and be in tune with how they're feeling in their body and being able to release that, because the tissues can hold on to this indefinitely, okay? So even just talking through it is one thing, but accessing this information and allowing it to come to your conscious mind through body work, through gentle hands-on release is really, really effective, okay? Especially if you haven't been able to talk your way through it at this point and it's still hanging on, okay? Try some really great myofascial release. Forgiveness, Valor is one of the oils that's in the Feelings Kit. There's 6 oils. Present Time is one of them as well. So just, again, bringing your awareness and allowing those releases to occur. So thank you for watching today. If you want more information on this, please reach out. I'd be happy to talk to you during a phone consultation or an in-person discovery session where we can sit down and you can tell me a little bit more about what's going on with you, and I can let you know if I feel like I can help you, okay? I do have a Recover Mama class coming up this Wednesday at 5:30. We're not gonna really do a lot of birth trauma stuff, but we're gonna start reconnecting with the pelvis, and I'm gonna talk about some general postpartum tips, okay? So if you're interested in that, you can sign up on my website at healingspotpt.com and look at the self-healing workshops page. So thank you for joining me today, and as always, if you have any questions, please reach out. I'm happy to help you. Bye-bye.